Hi, I'm a recent graduate from a nursing program. I am also a disabled veteran from the Air Force, where I worked as a medic. Most recently, within the last 6 months, I had a patient, and this was a 23-year-old woman who had been recently discharged from the Navy, who was completely and totally healthy. After getting out of the military, she became a security guard, which was a fairly low-paying job, but it met her needs, allowed her to pay her rent, and provided her with insurance. She became acutely ill and went into kidney failure. She was in New Jersey when it happened. She had been employed and living in Pennsylvania. When her kidneys went into failure and she was in New Jersey, she wound up losing her job. She also lost her insurance. Because she wasn't a resident of New Jersey, she wasn't eligible to apply for Medicaid. This patient, like other patients who experience situations and illnesses like this, need dialysis. This woman was receiving dialysis 3 days a week. It's a life-saving technology and treatment. Without it, people in renal failure or kidney failure die. This woman's family lived in New York. That was her support system. Throughout the months of her hospitalization, one of the biggest factors that kept her in the hospital was that she didn't have insurance, and there was no way to lift the red tape in order to get her onto Medicaid. Sadly, while she was in the hospital, waiting to be approved for disability, she died. She had gotten what's called a hospital-acquired infection, which was pneumonia. It's very common. It happens often for patients who are ill and in settings where people are sick. At 23 years old, she lost her life. But the frustrating thing is that if she had been able to be discharged, and if she was able to receive dialysis 3 days a week as an outpatient, she might still have been with us. For myself and my peers, and the nursing staff and the doctors and the team that cared for her, it was very frustrating to see how someone's lack of coverage, a young 23-year-old woman who had no serious prior illnesses, lost her life in a hospital room, not surrounded by friends and family, but with people who cared about her, cared for her day in and day out, prayed for her. It's heart-wrenching. Healthcare reform shouldn't be about a Democrat or a Republican stance. Every day, people are denied access to care, as this young woman was. She was denied access to a dialysis unit because she wasn't eligible for any type of insurance. She wasn't eligible for Medicaid in one state where she was in a hospital. She was unable to get her disability approved, so she had to stay in a hospital. And that's where her last days were. We all have choices. That woman at 23 did not have a choice. Maybe it doesn't affect you. And as a nurse, It may not affect me because my employer provides insurance. I have an ability to make a great income. But as a nurse, I also want to make a difference. So whether it was that young 23-year-old woman or it's a 60-year-old that tells me her battle with insurance companies over her chemo being paid for because 20 years before her leukemia started, she had had breast cancer and she's being denied coverage. The fear of her losing her home, the fear of how they're going to survive, is not the added stress that they need when they are fighting for their life. Get the facts about healthcare. Get the facts about how insurance companies work. Do your own homework. And please, talk to the people who are being affected by this. Talk to the patients who have been denied care by insurance companies, who have been dropped by their insurance carriers. We all need coverage. Thank you.